Good afternoon. This is Dr. John Ballis with Ballis Chiropractic. I'm here in Costa Rica at Infinity Regenerative Medicine, and I'm here with my friend Dr. Mike Simmer. This is our second trip down here, and we came last year along with our wives, and we received stem cells, and we've had a lot of patients ask us over the years about stem cell therapy. So we had such amazing results with what we did last year. We are back this year, and we want to show you how we're getting treatment and why we choose Infinity, because they do something very different than they do anywhere else in the world.
Our stem cells are sourced exclusively from the umbilical cord from natural births with zero complication. Our donor selection is meticulously managed with health assessments conducted to verify the donors are eligible. Every single sample is carefully screened, tested, and verified to uphold the highest quality standards. This is not just about maintaining quality, it's about ensuring your safety and optimizing the effectiveness of your treatment. We maintain a strict chain of command with minimal personnel involvement. Fewer hands, less risk. Every stage of collection, processing, and application is managed by a select group of highly trained professionals. This means complete accountability from start to finish. You know exactly what you're getting, where it came from, and how it was handled.
The stem cells that we are receiving are all fresh. They are never frozen. The lab is literally right next door to the clinic. It's a very clean, sterile environment. And the reason the cells are not frozen is because they are now more robust when they're not frozen. It is, again, very safe because they do a very heavy screening of the donor. I mean, this is easy. You can see I currently have an IV in. It was painless. The staff is always accommodating. They're very professional. They have kept in touch with us throughout the entire process, email, paperwork. If we have any questions whatsoever, we call or email. They respond very quickly. They're on top of it. It's just a very professionally run office from start to finish. They will call and check on us. So they are very well trained, staffed to where they can get you what you need, and it is top-notch.
Regenerative tissues use the technology your body has used your whole life to grow, repair, replace damaged tissue. When we are born, we have the biggest concentration of these things needed to do this. By the time we have grown, normally in our late teens or early 20s, we have used 90% of our supply. We live on the other 10% for the rest of our life. We continue using up our supply whenever we have an injury, a cut, or a bruise. For some people, the supply gets so low the body just can't keep up. The regenerative tissue we inject into your area of pain or problem concentrates on what you need to fix the problem. It helps your body to have the tools to fix, repair, or replace the damaged area.
I can start with a personal success story because I received cells last year. I had some in my back and an IV. Within a couple of months, I noticed my endurance was far superior, my recovery from workouts, because I do work out very hard and multiple days a week, 5-6 days a week, and the recovery from that and just being able to do more, it was just really noticeable.
Frequently, we check for microbiology, like bacteria, fungus, and toxins. We also check for the karyotype, just to be sure that the cells have no chromosomical disorders. We check for identity. This is like using flow cytometry. We basically scan the cells using some special markers to be sure that the cells that we are working with are actually mesenchymal stem cells in the right concentrations, right? So once we have the microbiology, the identity test, the karyotype, and all the controls are good, and we have the right quantities, then we harvest the cells the same day you're gonna get treated. Once we have the cells in a pool, we use a cell counter to know the quantity, the number of the cells to prepare the treatment. We also do the viability, which is the number of cells that are alive, because we want you to have like alive cells in your body, not dead cells. And we also check for the size.
Mostly we look at, in my clinic, people who obviously have joint problems. So if somebody has a knee problem, a shoulder problem, a hip problem. But we also look at people who have systemic issues as well. Maybe someone who has Parkinson's, for example, autoimmune issues. So somebody who has lupus, ankylosing spondylitis. It really, really works well. It works far superior than typical traditional medical treatments do. They treat symptoms. This is getting more to get the body to treat the actual disease process. We love this country. It's an easy flight in and out for us. You actually have a direct flight from Charlotte to San Jose. You get in about 1 p.m. You could literally be in the clinic once you get all your paperwork done and be out of the clinic by 4:30, 5 o'clock at the latest. Then you could be on the road to go to one of the many destinations this country has and go explore. Ideally, if you're going to come to Costa Rica, you should make it a little extra time and actually enjoy the beauty this country has. It's an incredible country. From the beaches to the wildlife, you have everything from monkeys, sloths, macaws, toucans, rainforests, gorgeous waterfalls, volcano. It's incredible, and you really should do what you can to spend the time here.
For more information, please contact Evan Ozasa at 360-878-3335.